Greetings, good people. Welcome back to my channel. Today I'll be demonstrating on how to take a blood glucose test at the comfort of your home. So this video is majorly targeting individuals who are diabetic or people who have been diagnosed with diabetes and they're under medication, they're on follow-up. So it's important to keep monitoring the sugar levels so that you're able to avoid the complications that normally come about with either high blood sugar levels, which is hyperglycemia, or low blood sugar levels, which is hypoglycemia. And actually I talked about those two topics in my previous videos, so you can revisit and check on the same. What you need to do is to purchase a glucometer or a glucose monitoring machine, and then keep checking the sugar levels at home. Ensure that you keep the records, and then the next time you're visiting your doctor or your physician, you carry along the recordings with you so that the doctor is able to monitor the progress. We normally have various types of blood sugar tests. For example, you have the HbA1c, we have the fasting blood sugar test, you have the random blood sugar test. So today we shall be measuring, or we shall be looking at the fasting blood sugar test. And this is a test that is normally done after 8 hours of fasting or after 8 hours of having not consumed any meal or any drink. And we shall be looking at this test because I have my client with me, and my client has not had any meal yet. It's in the morning, so we shall be doing a fasting blood sugar test. So if you have a relative, you have a family member, you have a friend who is diabetic, this video will be of help to them. So join me as I demonstrate on how to take the sugar test. So this is what we need so that you're able to do the fasting blood sugar test. We have our pack with us here, and the pack normally contains the glucometer or the glucose monitoring machine. We have the strips, and actually the strips have to match the monitoring machine. You see, like for example, what I have is from Code-Free, and then the machine is the same. It's still from the Code-Free company, but you can use any machine as long as, like any machine from any company, as long as the strips are matching with the glucose monitoring machine. And then you have a lancet device. This is where we normally put our lancets when you want to take the blood sample. We have our lancets here, and then you have some cotton that will be used to clean the finger before we take the sugar test. We have a book here with a pen. This is where we shall record the readings after taking the test. And then you have the surgical spirit. This is what will be used to swab the finger. So let's get started. So begin with uncapping the lancet device. So that's how it looks like. And then you get a lancet. Then you mount the lancet on the lancet device like that. Actually the lancet has some grooves that will enable it to fit properly on the lancet device like that. And then we uncap the lancet so that we are able to expose the needle that way. So you can see the needle. So normally when you are taking the sample, when you are pricking the patient or the client, you normally push the needle inwards, and then you press on this button, and then the needle will move forward and prick the surface or the finger. So after that we shall cover the lancet device. We get our strips. That's how the strip looks like. So this part will go into the monitoring machine like that, and then this other part is the one that will suck the blood after you pricked the client. So you see, after you mount the strip, the glucometer is actually showing us a sign of blood at the end, somewhere there you can see, meaning that it's ready to collect the blood. So our client is here. So we shall use, you can use any finger, but it's important to use the sides of the finger, as the tips have more nerve endings, meaning that it's gonna be more painful compared to the sides. So we shall be using the sides to prick and get the sample. So we shall swab or clean the place and ensure that it's dry, and then we shall prick the side of the finger. So if you normally feel seeing blood, or yeah, get ready. So we pricked the client, then you press a bit, then the blood comes out. You clean the first drop, because it may have maybe some spirit could have remained, and then this can interfere with the readings. So after you take the sample, you put some cotton wool on the finger, and then you ensure that the patient or the client presses on the finger or on the cotton wool. So these are the readings. That is 5.2 millimoles per liter, which is within the normal ranges. The normal ranges for a fasting blood sugar is between 4 and 7. So 5.2 is within the normal range. So after you take the recordings, you remove the strip, or you unmount the strip, and then you also remove the lancet. Ensure that you don't prick yourself, and then you'll discard or you'll dispose of the used equipment. Then after that, we shall be recording the readings, which is 5.2 millimoles per liter. Yeah, so that's all for today. Ensure that you'll carry the readings with you as you visit your doctor during the next appointment. Yeah, thanks a lot for watching. I hope the video has been of help.